in 5, or about 20% of the community at any given time, might be having thoughts of suicide. Here in Arizona, we have about 1,400 deaths annually to suicide. 90% of those that attempt suicide survive. I think the increase in loneliness that our members and our community are facing is a great concern. Post-pandemic, so many people are struggling with anxiety, depression, just a sense of being isolated and cut off from connections that formerly provided support. So I'm seeing that more with all age groups, and it's something that we're concerned and we're finding innovative approaches at Mercy Care to address. I'm Heather Brown, a prevention administrator with Mercy Care. One of our big initiatives is a Zero Suicide Initiative, which really looks at how can we decrease suicides in our communities? How can we bring those numbers down to zero? Part of that is creating a culture where we can have more direct conversations about suicide, implementing these evidence-based trainings like youth mental health first aid, Safe Talk, and Assist, applied suicide intervention skills training, which are kind of the gold standard for programs to prepare people to have those conversations for suicide intervention. Mental health first aid is about a full day training, and it's available for youth, for older adults, for adults populations. There's a piece of that that addresses suicide, but it also covers other mental health concerns. Safe Talk is about a half-day program, about 3-4 hours, designed to really help people identify when a person is having thoughts of suicide, how to ask the question directly, and then how to connect them to someone who can do the intervention. So it's really all about suicide can happen to anyone, and we teach a very simple 4-step method to be able to prepare people to be that alert helper and make that connection. We've seen great results with all of these trainings. We've been able to invest quite a bit and to train over the years thousands of people, not only our staff at Mercy Care who work with our members, but also people in the schools, people who work in law enforcement, first responder jobs, businesses. So at Mercy Care, we are committed to creating communities that are safer for persons having thoughts of suicide and struggling with suicide, anxiety, depression, and loneliness.